Hello and welcome back to Honest Healthcare. This week we're giving you the inside scoop on government health insurance with some tips on the application process for prospective residents of a skilled nursing facility. As you may know, Medicare primarily covers retirees who are 65 years of age and older, while Medicaid is intended for low-income Americans, and both cover individuals with disabilities. But here are some things you may not know. While Medicare is indeed a government insurance program, Medicaid is actually a government assistance program. Whereas Medicare kicks in automatically when you turn 65, Medicaid requires a detailed application to demonstrate your financial need. In the case of nursing home stays in the state of Connecticut, qualifying for Medicaid means demonstrating that your total assets add up to $1,600 or less, including bank statements and property you may own. If you do own property, it needs to be put on the market at a fair rate unless it's a residence where a family member of yours resides who fits into one of the categories listed here. But you can't just suddenly decide you want to qualify for Medicaid and sell or give away all of your money and possessions. The government agency you submit the application to will conduct a 7-year look-back to review your financial history and determine whether you made any unauthorized gifts to friends or family. While both programs cover nursing home services, Medicare is typically only for short-term stays. This is because it only covers care as long as your condition is treatable and you're making progress up to a maximum of 100 days. This puts the burden on physical therapists, occupational therapists, and speech therapists to prove their patients are meeting clear benchmarks of improvement in order for the patient to continue receiving care. It also means that therapists have to conform their treatment plans to fit within an arbitrary window of time and do their best to prepare patients to return to independent living in that time. As you might imagine, this can be especially difficult if the condition is resistant to treatment, if the patient struggles with motivation, or any number of complications that can arise. But what happens if the window of time for Medicare coverage passes and the patient still needs skilled nursing care? There is a process for applying to receive Medicaid if you're already residing in a nursing home, which the facility's social services staff will help guide you through. Because this may mean giving up savings or property, this process can sometimes lead to a degree of interpersonal tension or resentment towards providers. But it's important to remember that staff is only there to help you navigate a complex application for government assistance, and providers have no hand in the rules and regulations around Medicaid. In fact, as we'll see in the next section, the underfunding of Medicaid represents a major dilemma for providers. We hope this video helps you feel more informed about the process of seeking skilled nursing care through Medicare and Medicaid. We've listed some additional resources in the description below in case there's anything you still have questions about. Look out for part 2 of this series where we'll dive into the provider side of things and begin discussing current policy debates. If you haven't already, consider subscribing to be notified when the next video gets posted. Until then, stay well.